My name is Dr. Maurice Pitesky, and welcome to episode number 24 of the Sitch, a monthly show from the UC Davis School of Veterinary Medicine Cooperative Extension. This month, we're going to piggyback or chicken back on episode number 22, which provided some basics regarding poultry nutrition. I'm sure you all watched episode number 22 right after it dropped, but just in case, if you missed it or forgot the contents of episode 22, I'll sum it up. Feed chickens chicken feed. Not scratch, scraps, or shallots. Seriously, just keep it simple and feed chickens chicken feed. If they're layers, feed them layer feed. If they're pullets or chicks, feed them a starter feed. But if you want to learn more about what not to feed chickens, go watch episode number 17. So this episode is the first in a series about specific nutritional diseases. So today we're going to focus on rickets, which us humans can also get. Big picture, rickets in humans, chickens, and every other animal that gets rickets is caused by a deficiency of vitamin D3, phosphorus, or an imbalance between calcium and phosphorus. Of all these, typically a deficiency of vitamin D3 is the most common in backyard birds and in kind of field settings, and that is often secondary to bad feed that has been depleted of fat-soluble vitamins such as vitamin D. Ultimately, rickets usually occurs due to improper nutrition, which results in poor skeletal calcification. So in chickens, rickets typically cause soft and pliable or rubbery bones and beaks that appear deformed. You can see this in other clinical signs such as lameness as early as 14 days of age, and this typically happens in growing chickens, aka younger birds. In contrast, and this is just an important kind of subtlety here, calcium in laying hens results in, if you have reduced dietary calcium in laying hens, that results in reduced shell quality. So egg shells that are thin or breaking is usually one of the things you'll see. And that'll also lead to osteoporosis as the hens are drawing as much calcium as they can from the bones in order to support shell formation. Osteoporosis in laying hens can cause fractures in areas such as kind of the rib joints, the keel around the chest area, and the thoracic vertebrae. Those thoracic vertebrae, when they fracture, can also cause a lot of other problems, spinal issues, spinal cord issues, and things like that. So going back to rickets, the main treatment should be proper nutrition. So keep it simple. Remember episode number 22? You might want to consider supplementing with vitamin D3 and or calcium carbonate, but that's more of a thing for a veterinarian to kind of consult on. In summary, proper nutrition is one of the most important things you can do to provide your flock for a healthy flock. Rickets is a problem mainly in growing birds, but you can prevent rickets by making sure your growing birds get the majority of their diet from a well-balanced commercial poultry feed. To that point, don't get fancy with your poultry diets, as rickets can be caused not only by deficiency of calcium or phosphorus or vitamin D, but also by excess calcium. So when you start adding things onto the diet, that's when people start having nutritional diseases in general. Thanks again for listening. And if there are any topics you'd like covered on the Sitch, please reach out to me at drcluck@ucdavis.edu. Thanks. Bye.